Today, we're talking all about fat-reducing treatments.
Thank you very much.
Hi guys, welcome back to the channel. I'm here again today with Dr Euan, Dr Kishan, and we're going to be discussing fat-dissolving treatments or fat-reducing treatments that we do in the clinic.
I feel abused.
I am so sorry. So guys, do you have a favourite fat-reducing treatment for your patients or one that you've had done yourself? Go.
So I've had several of these fat-reducing treatments. In fact, I'm really into, because what we're doing at the clinic is a little bit different now. I think we're looking at the body as a whole, not just the face in isolation. We're looking at body contouring, we're looking at hormonal optimization, hormonal balance, we're looking at fat loss as well, basically trying to make an optimized, healthier version of you. And one of the tools that we're looking at is getting rid of fat in a healthy way and also promoting fat loss that can be a bugbear for some of our patients. So we've got different tools for this. I think I've tried fasting, calorie controlled diets, but there are pockets of fat that remain on the body, which can be a real troublesome area for our patients. So we've got injection treatments, so it's called injection lipolysis, and we've got principal ingredients that can be used to achieve this, and they're the components of most of our therapies, is deoxycholic acid or phosphatidylcholine. Now, there is some controversy as to which ingredients are the most effective, but I think in all of our products, deoxycholic acid is the ingredient that dissolves fat cells. Thereafter, the fat cells, they burst, and then the contents of the cells is moved out the body by the body's drainage systems or elimination systems. So we are quite on hand to recommend that you drink lots of water after treatment, but essentially we inject the area of fat and the fat cells burst and then the area becomes slimmer. Usually you need 3 to 6 treatments to really see a result, but we're going to talk about other treatments that can actually speed up the results for you better.
Still didn't answer the question. Which is your favourite?
Oh, my favourite? I'm so sorry. So I actually quite like Celluform, which is a fantastic treatment because it contains arnica as well as the principal ingredient deoxycholic acid to help burst fat cells and move them away from the body's troublesome areas with minimal bruising. And having had it myself, I think it's quite good for us to try these treatments. It doesn't hurt that much, even while you're having it, and even afterwards, the downtime was quite minimal. Yeah.
So I'll tell you about my experience of fat dissolving. I'm quite skinny. Sorry. I don't think that. So I'll tell you about my experience of fat dissolving. So I've had maybe 2 or 3 treatments in the past with a couple of different agents. I've had Celluform and I've had Deso body. It's good for me because I am quite slim. I do exercise, but I've got kind of persistent fat pockets just kind of like on the hips for me is my trouble area. So no matter how much I exercise or diet, they seem to just always be there, and it was kind of annoying me. So I had both of them, and well, at the time it's some injections, right? So it's not too uncomfortable. For me, I've got quite an average to good pain tolerance. I'd probably rate it about like a 3. Not too bad. All the patients I've treated have managed really well. In fact, some patients we cover huge areas on the body in one session, which is a lot of injections, usually absolutely fine. And it does swell up almost straight away, right? So it goes really red. It feels like itchy and hot, and that's normal because that's the inflammatory response as the fat cells are popping, because it's basically deoxycholic acid is something that you make in your own body in your bile, and bile's function is to emulsify or break down fat so it's easily digested. So that's what's happening in the fat pocket. The fat cells are popped, a little inflammatory response then takes place, and they're cleared from the body over a process of a few weeks, but the actual part where the fat cells are popping is like within minutes of the treatment, and then it just takes some time for it to clear. So you do feel like a bit gross afterwards, bit red, it does swell up. So anyone that's had it under the chin before will know it can swell up and look a bit odd, and that can last like maybe a week for most patients, I'd say. So you need to plan it around events. You don't want to go for a job interview the next day. You don't want to get married the week after. You just want to give it a little bit of time. But after a week or so, once everything's settled, it's fine. And I've had some really nice results. So they're definitely a lot smaller than they were. We did a little bit at the base of my abdomen as well, where you get that kind of bit above the waistline. It's gone now, and I had 2 treatments, so I'm really happy with it.
I just want to talk a little bit about the different types of product that are available in the UK. So we have a plethora of different fat dissolving injections that one could have. One that people have probably heard the most about, at least here, is Aqualyx. Then you've probably heard about Kybella or Belkyra. The Kybella / Belkyra is not available for use in the UK. And with the Aqualyx, actually I'm tending not to really use it so much anymore because of the amount of swelling that people get afterwards. In my experience, it's certainly less with the Celluform and the CelluformPlus. And recently we've been using the Deso as well. The Deso is interesting because you can use the Deso face for the eye fat. Which is something that we can't use the Celluform for.
No, it's a slightly lower percentage of deoxycholic acid because the one that you'd use on the body would be far too harsh around the eye. It's quite a localized small fat deposit there. But for some people, the bulging of that fat under the eye does cast a lot of shadows. It makes them look old, tired. And that tends to be why people come in and asking for a solution to that problem. If there's fat there, you can try and disguise it with fillers. But really, you're not treating the problem, you're kind of just masking it. So with Deso Face, we can get rid of that underlying issue, which is pretty cool.
So the Deso Face comes in at 0.5%. I know you guys like technical aspects there at home.
Right.
So it is lower than you would find on the general Deso, which comes in at 1.25%. And then we've got 2 different types of Celluform. So you've got the regular Celluform and the CelluformPlus. The regular Celluform doesn't contain arnica, and that is up to 4.9% deoxycholic acid and up to 9.9% phosphatidylcholine. And then the CelluformPlus is the one that contains the arnica, in which we're using underneath the chin here and for dissolving the jowl fat as well. And that's got the deoxycholate 4.9% or up to 4.9%. So how many sessions would someone need to do a treatment like this?
Well, it varies. It really depends on the size of the fat pocket. So for me, when I had a slightly smaller fat pocket, I had 2. I think I've had 3 on the side, 2 on the abdomen, and it's fine, it's gone. But if you've got a larger fat pocket, then yeah, you're going to need to have up to maybe 6.
Yeah.
You space them out maybe a month apart. So it's a process, but every time you do it, you are dissolving fat. So it's gradual. But if you're looking for a non-surgical solution, you don't want to have liposuction, for example, and if weight isn't shifting with exercise, it really is quite a nice option to have.
I think it's also worth saying as well that you can only treat small pockets of fat. So you can't, come in and have like a whole 360 degree on the legs and the arms and everything. You've got to be kind of close to your target weight and not really doing an area, I would say, like palm of your hand, maybe double that if you're doing an abdomen, something like this. So there are limitations with these treatments, but you can treat areas that, for example, you can't treat with liposuction or is difficult to treat with liposuction or with CoolSculpting. So for example, with CoolSculpting, you'd be able to do the submental region, but not really the jowl area, not the face. You've had fat freezing.
Yeah, it's like a spot treatment, isn't it, really? So if you've got that persistent pocket of fat, as we talked about before, I think it's quite convenient, really. I mean, you lie back, you have your area of fat sucked up into the device. It goes very, very cold. And afterwards, you notice that the skin has become really hard, almost like a frozen pack of butter. That's literally how it feels.
Delicious.
And and it takes a day or 2 for things to settle down. But I did notice a little bit of improvement. And I think, like all of our treatments, when you layer them in with the other injection treatments, for example, I think you get much better results.
You should do the big reveal for your new machine.
Ta-da! We got CoolSculpting!
Yay.
Hurrah! 2 of them, so it means that you can do both sides at the same time. And the machine is a new machine, so instead of it taking like an hour to do a cycle, it takes 35 minutes, so it's quicker. So you're in and out, because we're all busy, aren't we? All
We are
busy.
very busy.
All busy, yeah.
Do you ask the patients to do anything else to support fat loss? Do you have that conversation?
Yeah, I mean, we should always talk about the healthy, balanced lifestyle. Most of the patients I have coming in are actually usually pretty healthy, active, eating well, and they're just really bugged by that persistent fat. But I think afterwards, if you tell them, if you now step up your exercise regime, the results are going to be better.
That's right.
So always advise that.
Weird areas that you could treat with fat loss, weird things that we've been asked for. I suppose the weirdest thing for me has probably been bra fat. It's not weird, but actually I've done that myself.
Knees. People don't like fat knees. I've done some knees. Just a bit of fat above the knee. For some people with really slim legs, fat still accumulates above the knee. And, if in the summer, when you're wearing shorts or skirts, things like that, it can be quite, upsetting. So it's quite...
for me, it's not weird at all, but it's that sort of under chin, the submental fat.
I've had that.
Yeah, it's quite commonly asked for, isn't it?
Do you know, I had that after I had liposuction here a few years ago, and I do think it helped to give a better contour to the neck.
Staring at your neck now.
Yeah. Gorgeous from the side, gorgeous. The people that make Celluform, they also make another product as well called Gingerlytic, which is good for people who have got like flaccid fat in the legs. So, that kind of like fluffy sort of edematous fat that sometimes people get. Jiggly.
Yeah,
the jiggly fat. So it contains a third as much of the active ingredient, but also with some ginger as well, because then it helps to improve the lymphatic drainage there too. And I've had some quite nice results with that as well. Last but not least, I wanted to tell you guys that I am having a BBL just after Easter. So I am going to take you on the journey. I have no idea when this video is going to be released, so maybe they will be around the same time. I don't know. So I have had myself like various different areas dissolved with fat, but I want to like move the fat, not just get rid of it. So I'm having that done with a butt implant. So fingers crossed, I don't die.
Don't die.
Okay guys, so that's all we've got time for this week. I hope you enjoyed the video. If you have any questions about fat dissolving, please let us know in the down section below, and we will see you again next week for more joy. Bye bye.
Bye.